My name is Colin Jones. I'm a veteran of the United States Marine Corps and an academically trained bioethicist running for president in 2028 off the most popular agenda platform in American history, and I'm extremely passionate about women's health, and I've worked directly in women's health. As a oncology clinical research professional at the University of San Francisco, California, I worked and supported clinical oncology trials for women's oncology directly. I was horrified at the current funding state of women's health. We have amazing physicians, we have amazing professionals working to try to solve problems in women's health, and we don't have nearly enough funding, we don't have nearly enough attention paid to it, and the results are more women dying. My first draft of the agenda for women's health has 7 points that it's structured around. The first is to codify reproductive freedom for women in America. Government should not own your body, no matter what your gender identity is. Second is what we call the women's right to live, where we want to stop politicians from playing doctor and, as a result, endangering women's lives. That means restoring and strengthening federal guidance, protecting emergency pregnancy stabilization, even when termination might need to be medically necessary, per the patient's wishes, and critically protecting the physicians and caregivers who are involved in that process. Third pillar is fertility freedom. We want to ensure that you have equitable IVF access and contraception access. Fertility freedom doesn't just mean the right to avoid a pregnancy, it also means that you have the tools to help build a family, and that IVF is an option on women's tables. Fourth pillar is maternal health and Black birth justice, making it safer to survive pregnancy for women, and closing the structurally racist gap between Black female maternal mortality rates and white patients. Black women die during pregnancy at twice the rate of white mothers. And that does not exist for any biological reason. That is due to structural racism in medicine and accessibility in America. Fifth pillar is rebuilding the NIH and forefronting women's health research as a part of that. To be a woman is not a niche condition, and it's insane that that's how it's treated in research accessibility in America. Half the country are women. We need to be making sure we have the most funding and best minds trying to solve women's health problems. Sixth pillar is looking at family rights, paid family leave, and caregiving. Because family values don't mean a whole heck of a lot if you can't afford to survive, if your family can't afford to survive. The seventh pillar is looking at reproductive data privacy and making sure we have anti-surveillance protections. Your period app should not be used as evidence against you. That is Orwellian, that is draconian. And the capstone eighth is a commitment that women's rights are civil rights, like I said in my first video on the topic. Women's rights are intersectional. They intersect at all points across our agenda spectrum. A serious women's healthcare agenda therefore needs to be an equal protection plank of the campaign, not merely a limited scope healthcare plank. It is my intention to create a women's healthcare situation in America where you feel confident. You could feel confident in the providers you have. You feel confident that the government is funding research to help your issues, to help your problems, and that you never have to doubt that again. Thanks. Talk to you later.